Hovertech International's inflatable Q2Roller lateral turning device easily turns patients without manual lifting or pulling. The Q2Roller provides an effective solution for caregivers who need to reposition patients frequently for pressure relief, hygiene, and/or wound care. Breathable fabric minimizes heat and moisture buildup, making it comfortable for the patient and protecting skin integrity. As an alternative to wedges, one caregiver can safely turn the patient using air to offload pressure areas. More than one caregiver may be needed for additional tasks using the Q2Roller. Using the variable speed Hovertech air supply, each of the two adjustable chambers can be inflated to gently roll the patient to a 30-degree or to complete a side lying position. It is ideal to place the Q2Roller on the bed prior to the patient. Align the Q2Roller center line to the middle of the bed. Place the top edge of the Q2Roller approximately where the middle of the pillow will be placed. Tuck the apron edges under the mattress to secure the Q2Roller. Place the half-size hover cover over the Q2Roller. If the patient is already on the bed, use a log rolling technique to place the Q2Roller with two caregivers. First, open the Q2Roller and find the center line. Fold the product to the center line. Bend the patient's knee and roll them onto their side with one caregiver stabilizing the patient while the other caregiver will place the Q2Roller. Align the center of the Q2Roller with the middle of the bed and the top edge with the midline of the patient's ear. Tuck as much of the Q2Roller and apron under the patient as possible. Lay the patient in a supine position and then roll onto their opposite side. Untuck the other side. Lay the patient supine. Tuck the apron under the mattress to secure the Q2Roller. Straighten the half-size hover cover. Raise the side rails and bend the patient's knees to a comfortable level to assist in turning. Press the adjustable speed on the air supply 2 times to gently inflate the chamber. The button may be pressed up to 4 times for additional airflow. Press the hose against the black inflate valve. The chamber will begin to inflate and the patient will turn. If turning to offload pressure, inflate until a 30-degree angle is achieved. Slightly inflate the other chamber just enough to reduce the pressure from the patient lying on their side. The black valve has a flap that can be depressed to slowly release air from the chamber. This adjustability allows for small amounts of air to be released for patient comfort and to provide microturns. For emergencies, the red valve can be opened to quickly deflate the device. To fully turn a patient for hygiene or perineal check, fully inflate a single chamber. This will completely turn the patient on their side. While turned, stabilize the patient and deflate the chamber to expose the area. After complete, return the patient to a supine position. If the patient needs assistance with stabilization when sitting in bed, the Q2Roller can be used with both chambers inflated to stabilize patients who commonly list to one side. Inflate both chambers and adjust to straighten the patient. To assist with early mobility, the Q2Roller can be used to sit a patient upright on the side of a bed. This technique requires a minimum of 2 caregivers. Start with the patient in a supine position centered on the Q2Roller. Bend the patient's knees to assist in turning. Fully inflate the first chamber using the adjustable setting on the air supply. Lower the bed so the patient's feet will touch the floor. Raise the head of the bed as far as it will go. One caregiver will be inflating the deflated chamber and monitoring the patient while the other caregiver will be guiding the legs to dangle at the side of the bed. As the deflated chamber is slowly inflated, the patient will begin to slowly sit further upwards. As the patient sits up, the caregiver assists the patient to move their legs to the side of the bed. That caregiver will also support the patient's knees while sitting on the side of the bed so they do not slide. The patient's back will be supported by inflating Q2Roller chambers. When frequent patient turning and early mobility are your goals, choose the Q2Roller for caregiver and patient safety.